And the purpose I want to do is talk a little bit about the philosophy of child first and where it comes from and why it improves youth justice outcomes. It improves outcomes for children in the justice system, it improves outcomes for communities, and it improves outcomes for the state because it's cheaper. And use time to reflect on how this can be translated into a Chicago, Illinois context. Well, in general, what does the research tell us? We all know this. Adolescents are developing, especially in terms of their decision making, impulse control. And we know that's especially so within the male population, where the research would tell us now that it's not really until 28, maybe 29, that males are fully developed in terms of their impulse control and decision making. And it's males that predominantly interface with the justice system. And we know that trauma and adversity are common among justice-involved children. I conducted some research probably about 6 years ago in our Juvenile Justice Centre, which is a secure institution for those who have committed the most serious offences. And out of 110 children in there, they'd all had a minimum of one traumatic incident in their life. The majority are between 3 and 8, which impacts on their behaviour and impacts on how they interact with services and statutory services. And we know that the research tells us that there's something about a criminal justice system, in terms of shaming, that it's criminogenic. And I've had 30 years working in criminal justice system. I trained as a social worker and entered adult probation in London, and then Manchester in England, then over to Belfast. But systems are inherently criminogenic, and for the best will and the best efforts, we've always struggled to develop really good outcomes and impact for people going through them, and especially for children. And we know that due to labeling and other theories, it reinforces their identity and increases recidivism. What the research tells us is the importance of relationships, that key person. And in my agency, the key thing that all staff are trained to do is develop a good, solid relationship. That comes first with all children. And that's central to the child first philosophy, because developing that relationship develops trust and it gives a platform to work. And also developing opportunities for children, opportunities to do with education, substance misuse, mental health, reduces reoffending, and not necessarily traditional interventions that we've seen, like anger management, behavior modification programs. Well, where did it come from, Child First? It was developed in the UK and predominantly within country Wales and South Wales. And South Wales had two what they were called youth offending teams across 2 towns. And both of these towns had very similar demographics. The poverty indicators were the same, the birth rates were the same, the size of both of the towns were the same, around 120, 130,000, not too large. But when the chief executive was appointed, a new chief executive for the whole of Wales for the youth justice system, he noticed his conversation was, well, I'm not a social worker. I have no skills working with children. I'm a data analyst. And looking at the data, I can see that one town is developing really good outcomes for children, low incarceration rates, high completion of statutory orders, early intervention, lower children coming into the system. And that really started the whole conversation and the research for Child First, which was then developed by Kevin Haynes and Steve Case, 2 academics in England. Child First, importantly, is anchored into the United Nations Convention on the Rights of the Child. And the United Nations Convention says that children in a justice system should be listened to. They should have a participative role. They're not silent actors, and they're not children who should be done to, but whatever we do should be done with children and alongside. So, for example, in my agency, we have a participation officer, and their role is to ask children about how well we're doing as an agency, how well my staff are doing. How are our policies impacting on them? What can we do differently and what can we do better? Because they're our primary service user. And if any of you are fortunate enough to buy a new car, mine's quite a few years old, but if you buy a new car, you're usually tortured by the manufacturer and asking for your opinion, how it drives, how it can be improved, etc., etc. Well, children are primary users. So we ask them, as the user of our service, how well are we doing? How can we improve what we do? Child First was also influenced by developmental psychology and desistance theory predominantly from Shad Maruna. And I'm sure majority of you know Shad Maruna. He's a professor here in Europe, but I think he's originally from Illinois. And his work has been incredibly influential on Child First theory. Child First also builds on trauma-informed practice. And there's a semblance of Child First where it's not that new. It derives a lot of its ideas from positive youth development, which came from America, and a lot of its ideas as a critique of the approach to work with children, which is offence-led and offence-focused. Well, when it comes to the actual Child First model, there's four general principles that we see children as children. We promote a positive identity for children going through the system and build really strong partnerships and promote diversion. The fourth one is absolutely crucial. And I'm going to go through these and talk about how we've embedded them within Northern Ireland. Seeing children as children, quite often justice systems are watered down, youth justice systems, pardon me, are watered down adult systems. They are an abridged version, and we use the language. We use the language of youth, juvenile, adolescence, which is kind of it's a different language than saying child, because child evokes images of innocence and passiveness. But when we use the language of youth, juvenile, and so on, it gives almost an abridged version. So we're not actually dealing with children. They're almost like mini adults. And within the Child First philosophy, that's one of the main criticisms, that we have systems that are essentially adult systems that have been adapted for children that really aren't responsive to children's needs. Child First also recognizes developmental maturity, and that because of that, children need very bespoke and different services. And the underlying that is a sense of they are still vulnerable. They are vulnerable to exploitation, even though they may have committed some horrific offences. And they've come from backgrounds quite often with complex trauma. And consequently, we need to develop responsive systems and responsive interventions to meet their developmental stage and their needs. Second principle is to promote a positive identity. And that means moving away from labels. In my agency, we don't use the term offender or young offender. It's child and children. Sometimes you'll get the odd policy document that squeezes through with youth in, young person. But we would follow the United Nations Convention of the Rights of the Child. Literally, it's child and children. And we know that labels like offender are criminogenic. We know it's stigmatizing. Part of promoting positive identity as well is to support education. And we have a massive push on education, training and employment for young people because it's still the number one pull away from offending, as are positive relationships. And part of that is also encouraging pro-social identity and a sense of belonging, moving away from the label of offender just to Kelvin, who's a child from that local community who happens to have specific needs, and reinforcing positive achievements. So anything that a child achieves in my agency, and that may be, we have an award called the Duke of Edinburgh, which is a skills-based award right throughout the UK. And the Duke of Edinburgh recognises that skills that a child may develop and volunteering that they may do. And we would hold celebrations after a child achieves that. Or if a child completes an order, we would hold a small celebration and take the child out for a meal. And constantly reinforcing their positive achievements throughout their time with the Youth Justice Agency. You can't achieve child first in isolation, either with a child or cross agency. And families are key. The state makes a very poor surrogate parent. We would work actively with parents. So after we would engage or do a program of work or intervention, whatever we want to call it, with a child, on a regular weekly basis, we'll check in with mum, check in with dad. If they're not around, we'll check in with the care home, foster carer. We'd involve them in the plans, in the interventions, and communities are also part of the solution. We're no different. Communities look at justice through two lenses. There is a sense of sometimes distrust of justice systems, and in the other sense, there's a sense that we know communities aren't given their place. We can't achieve what we do and the outcomes that we've achieved, which we'll come on to, without working with communities. And that can be for a number of, beg your pardon, that can be for a number of really collaborative, positive projects that we would run. So we would work with the education department, we work with the social services departments in terms of multi-agency collaboration. And to give you one example, we were scratching our head why so many children that we work with won't engage with mental health services. And we had an attrition rate of 89% of children referred but not taking up services. And the services are like gold dust. So we looked at that. So, well, how can we model that in a child first manner? Because when we asked children, why is it you're not engaging? They were saying to us, well, we don't like going into the services because they're based in a hospital. And above there's a big strap line saying mental health services this way. So is that all that stigma of being involved? Likewise, when children did engage, because there's such a long waiting list, with missing opportunity in terms of motivation. So we sat down with our colleagues in the mental health and thought, let's look at this through a child first lens. And we developed a co-located worker partnership. And that partnership involves a mental health nurse coming into the Youth Justice Agency for 2.5 days a week, working on a social work, on a youth work model, seeing the child in their home, in the community, in a youth centre, even in the school if need be, to provide those services. And engagement and completion of programs has flipped. So we have almost now 90% completion. And victims should be meaningfully included. Right throughout what we do, restorative justice is central. It's not the be all and end all. It's not appropriate for all children, but for those that it is, it works, and it works well. Looking at the fourth principle, promote diversion and early intervention. And this is really difficult sometimes for statutory services and statutory providers, because there's a sense that you're giving away funding potentially for statutory services because budgets are so tight. But we know that sometimes the best intervention for a child is not to enter the justice system. And we avoid entry into the justice system at all times. So we have a multi-layered system in partnership with the police, with the prosecution service, and with the courts to keep children out of the system, if at all possible. So a child has to go numerous layers, numerous interventions before they put themselves into a court setting. And we know that early intervention is more effective and cost effective. So central to child first, it's a no-brainer because it works and it's cheaper. It's a cheaper form of justice that has better impacts with children. And what we found in Northern Ireland is that it reduces that long-term system demand. So the number of cases and children going through our formal court system has absolutely plummeted. We still have youth courts, obviously. They're still busy, but nothing like they were before. The number of children going through has reduced dramatically. And we know community-based responses work better. It's cheaper than locking children up. It's more impactful in terms of reoffending, and it keeps the child in the community with the parents, with those community services, with those employment opportunities, and so on. Well, one of the critiques of child first is that it moves too far away from behaviour and the offence, which I don't think is entirely accurate. Um, but that's not to say that when a child comes into the Youth Justice Agency, we don't use the offence, but it's not the trigger point. It's not a trigger point in terms of a child comes in with a violent offence, therefore they need a programme in anger management. We would take a multi-layered, systemic approach to assessment and looking at what a child's needs are. But the offence is still important. It understands context and it gives meaning for what a child's behaviour at the time. But what it does, though, that what we have done, we've moved away from the very narrow offence focus work, addressing offending behaviour courses, because we know that the impact of these programs is minimal. And we've often invested as a state and as a society an incredible amount of money in those programs for little return. And it also means that we've had to move away from generic stigmatizing activities, so some reparation, some community work, community service work, and we've had to look at that very, very differently. And likewise, when it comes to risk, we've had to look at risk very differently. And the reason is for two reasons. Oh, sorry, the reason is for a number of reasons. I think firstly, there's always been a tension and a misunderstanding between risk of reoffending. A child comes into a justice system, you assess their likelihood of repeating that behaviour again, and risk of harm. And that's confused assessments, and it's confused service delivery. We've moved away to a more systemic approach. So we don't see the behaviour or the risk sitting within the child. A child may commit some horrendous offences and cause significant harm, but we see the harm as being inherent in certain systems that the child will go into. So we know that some children, their risk can escalate with parents, and parents can be victims. So it's that family system. Likewise, it may be in the peer system in the community. But then parents are telling us, oh, they're absolutely great when they're with the grandparents. It's not a problem at all. So we know that risk jumps from system to system. And likewise, we will work with that through the systems. But we've moved away using language of risk, and we've changed that to safety. Because for any of you that work in a justice system, especially in a statutory setting, you mention risk to practitioners and they freeze. And they often make the defensible decision. And a defensible decision is following a policy and a procedure, but it lacks creativity, often lacks impact, and it often responsibilizes the child for their behavior or their lack of engagement, not about what we can do as professionals differently. But by reframing from risk to safety, provides space for that constructive work. And when we talk about safety with children, it also means their safety, safety for future victims and a current victim, and also safety for that worker too. Well, what does it look like in Northern Ireland? We talked about a multi-layered system and how we work collaboratively with our colleagues and partners within the police, the public prosecution service. So we have a number of systems, and I talk you through how a child enters our systems. So if a child commits an offence, a felony, and it's deemed as minor, that can be theft, it can be some assaults, the police will offer the child what's called a community resolution notice. And a community resolution notice, they'll speak to the victim and say, look, this is the action we're thinking of taking. Are you okay with this? Maybe if the child apologises, whoever it may be. And if the victim's okay with that, they refer the child to the Youth Justice Agency, and it's all voluntary. The child then would come to the Youth Justice Agency and would do a very, very brief programme of intervention and an assessment looking at what their needs are. They were then offered on a voluntary basis further support should they want to do that, but there's no compunction. The child won't be compelled. If the child commits another offence within a 6-month period, they can then be processed through the police and the prosecution service. And I use process the term lightly. It's not a positive term to talk about children in that way, but their case can be processed. And the prosecution will look at it and they will offer the child an informed warning. An informed warning is a bit like a caution in old language, and that's delivered by a police officer. but they don't deliver an informed warning or caution in a police station. It's done in one of our premises. So it's child friendly, and the child has the opportunity as well to engage in voluntary support services. If a child continues to commit offences, they can still be given another informed warning. But if that fails, then the prosecution service have their power to divert the case away from court for what's called a diversion of youth conference. Now, at this stage, Kelvin may have had 2 or 3 community resolution notices, or maybe 1 or 2, may have had an informed warning. But then it comes to the prosecution service for a diversion of youth conference. The child will be referred to our agency, and what we do has a legislative mandate, but it bypasses court. So we'll meet with the child and their parents and prepare them for a restorative meeting with the victim and agree an action plan. And the action plan goes back to the prosecution service in a formal court, and the prosecutor has the power to make that order, legal order. It bypasses court, and so the child doesn't have a conviction. If the child then still continues to commit offences, then it goes into the formal court system, and it's still dealt with restoratively in the same manner through a youth conference, which is a terrible name for a restorative intervention, but it's the legal framing. So a child can have a number of different interventions at different stages of going through. The child will never, ever, on a first offence, unless it's so serious, go straight into the court setting. They may have had 4 or 5 different interventions prior to that. So we have a layered system. And the backdrop to that is restorative justice. We prioritise with a child their safety and their needs. So we've turned our assessment processes on their head 360. So our assessment processes now talk about a child's need, not criminogenic need, but their general needs. Our assessment process talk about safety for all and not risk management top down. We work actively with families right across the system. We have parent support groups. We have one-to-one parent interventions. And we have a strong push in education and employment pathways. We have checks and balances within our system. So a child can be referred to a community resolution notice every 6 months. What the police do, the senior police and senior prosecution service, they will meet every 3 months, and they'll look at all the community resolution notice that have been passed in that period, and they would dip sample to make sure it's appropriate and that we have the correct gatekeeping procedures. And likewise, we would meet with the prosecution service and undertake a dip sample and look at how well we dealt with diversion of youth conferences. So there's checks and balances right throughout the system, culminating in what we call the Criminal Justice Inspectorate Northern Ireland. And that's a semi-independent body. They have the power and the remit to inspect any criminal justice systems at any time. The courts, prosecution service, the police, youth justice, adult probation, everything. And they can go in at a very short notice and produce a full inspection. So there's full transparency there. I'm going through a really fast-paced whistle-stop tour of Northern Ireland. But what we found is that by embedding child first, we're generating some real positive outcomes. So we've had a 50% plus reduction in the number of children entering the formal justice system for the first time for offending behaviour. So what we would talk about is the formal system is court. And with 50% reduction, which is a phenomenal amount. And that has been on a regular basis in 2011, 2012. So it's the number has decreased year upon year. And we've had a 60% reduction in the daily average number of children held in custody. So this morning I looked at the numbers and it was either 7 or 8 in our Juvenile Justice Centre, which has a bed space of 48. And in the young adult, male adult system, it was 180 about 14 years ago. and it is now sitting around 40. So we can see, because we've embedded these systems over a number of years, how they're beginning to pay dividends in terms of children going through a formal system. And we've had a 70% plus reduction in the number of children dealt with by the courts itself. So our court lists, from being chaotic and at times really unmanageable for the district judge, have significantly reduced. Not all good news, because we're notoriously slow at case progression. So even though we've had the number of children going through is reduced, the time it takes is still, we think, too long. And that's a quote below there from the Criminal Justice Inspectorate, from an inspection report into the Youth Justice Agency in 2024, which I led on, and we're very proud of that inspection report. That the work of the agency and its staff has been pivotal in reducing the number of children prosecuted in the youth court, because all of these layered interventions have been achieved in partnership with the Youth Justice Agency and the police and the prosecution service and the courts. We know there's benefits for communities, because communities are safer if children aren't committing the same volume of offences. And there's lower long-term justice costs, and that's tangible. We've got fewer children going through courts. We have got fewer children being incarcerated, and the cost of incarceration is absolutely incredible in Northern Ireland. And we've got much more effective prevention systems. And I think because of that, we have better and stronger public trust in institutions. And I think sometimes there's a popular misconception that public only have trust in institutions if it's get tough. And that's from a really strong get tough policing perspective. We haven't found that. And we think in terms of we're providing services and we're including communities, then the trust within institutions is further embedded from a position around 1998, where the trust really wasn't there in our institutions. A key message for those of you taking forward Child First is that it cannot succeed within one agency. We ploughed this field, but we did it in partnership. We did it in partnership with colleagues in the Department of Justice and the policy side. We had a minister who was fully on board, the Justice Minister, and we did this in partnership with policing and the prosecution service, because justice 15, 16 years ago was very different. We weren't producing positive outcomes for children. We weren't making tractions on reoffending. The courts were just littered with children for very minor misdemeanors and very high reoffending rates. Key partners within Child First, we found, are education, the social service and mental health provision. Community organisations must work together for it to work. It cannot be done in isolation. So for you as leaders, what can you do? Well, encourage diversion policies. Divert from that lower hanging fruit, to use a business analogy. It makes no sense to have children sucked into a justice system for minor misdemeanors. Invest in early intervention, invest in that provision. So children that can be diverted, they have support. And support trauma-informed systems and trauma-informed interventions. The last point there is measure outcomes beyond reoffending. Absolutely crucial. That I'm going to end on is children who offend are still children, and systems that recognise a child's development and have a relational approach and recognise that children need and want opportunities are far more effective at helping a child build a future. And if they're doing that, they're reducing reoffending. And by reducing reoffending, you're protecting communities. And so to end Child First for us in Northern Ireland, it's a bit of a no-brainer, to use the old adage. It makes sense, it has the evidence, it's cheaper, and it's more impactful. Thank you.